be about an hour-ish from past history, just to let you know. So here we go. Now I'll be getting these up into the professors today. So hopefully you'll have them posted in your announcements by then, okay? So here we are, exam one. You know, exam one is the one that has a lot of theorists. As we go forward, it's going to be more of the diagnoses, and it's actually a little bit easier to remember that than the theorists. So Erikson, we know that there are infants, toddlers, preschoolers, school age, and adolescents, and all of them have words that describe them. So infants, and you're going to see this on the exam. I believe there's 5 different theorist questions, just to warn you, okay? And they're simple. Just know that infant, trust versus mistrust. I cry, somebody gets me, I get fed, my tummy's full, I'm happy. I'm trust. Very happy person. When you get into toddlers, this is where they want to be autonomous. They want to do it themselves, but mommy and daddy are always stopping them because they're afraid they're going to be hurt. That's the shame and doubt. Initiative versus guilt is now they're starting to take initiative, do things, try to help mom and dad, but the guilt is when they can't do it all. Industry, most asked question on NCLEX across the board. School age, industry, what is it? Well, children do things well, and some children do other things not so well. Whether it's you're good academically and bad at sports, or good at sports, good academically. I think that's a really good analogy. Industry is, I'm the best speller in class. I am the best math person. I can bake a cake better than anybody. I can, whatever it is, task. Task I do well. And why do they want to do it well? They feel good because people tell them, you did a great job. Wow, how did you know that? And then the inferiority is they don't do everything well and they want to. So that's the inferiority. Adolescence, remember, this is the age of figuring out who am I? This is identity. This is who am I? What do I want to be? Who do I like? Do I like girls? Do I like boys? What group do I want to fit in? Is it the band geeks? Is it the nerds? Is it, you know, the artsy people? Is it sports people? My identity. And they go through this, I don't really understand. And that's the confusion. That's adolescent trying to figure out who am I? So Freud's all about anything sexual, okay? Oral, anal, phallic latency, and genitals. All about sex, boys, girls, and it starts with oral. Remember, what do they do with a pacifier? They self-soothe. They take care of themselves. And what do they do with their mouth? They explore the world through their mouth. That sensorimotor, right? What does it taste like? What's the feeling of it? You know, how does it feel in that mouth? Anal is potty training, okay? Phallic is girls like dads and boys like moms. And it's just that thing there. And it's also about same-sex peers at the late of this, okay? Latency, okay? Which is, again, the end of the Freud, which I just said, which is now your best friends that you hang around with are same sex. Now, when you get to the beyond puberty or adolescence, and then you want the other sex if that's who you're attracted to. And that's that exploration of, you know, sex and puberty and going through all those hormone things. Now, Kohlberg. You don't need to know pre-conventional, conventional, and post-conventional. What you need to understand, this is all about morality, right and wrong, and doing the right or the wrong. Now, the younger children know there's a consequence. Any good, you might be praised. Any bad, you're going to get punishment. School age children, which, you know, if you want to say conventional, school age, they want to please. They want to do what they're supposed to do. And then as it gets older, adolescents, they know what they need to do to get along in society. So they know how to hold a job. They know how to get what they want from mommy, as I call it. You know, they know what's accepted behaviors. Now, Piaget. Piaget is all about thinking and developing and understanding and taking a pacifier, seeing it in their hand, and it just accidentally ends up in their mouth and they say, "Oh, I like that. Let me suck some more." And then they'll go and they'll find it with that object permanence, right? Now, sensory or motor goes all the way up to about age 2, they say, 24 months. It starts out with, again, finding something, then finding that rattle, holding it, and then moving it. Oh, makes noise. Oh, I like that. Make more noise. The tertiary circular is that fifth stage of sensorimotor. It's the end of exploration. But what they say about it is they're actively experimenting now. They're saying, okay, I have all of these blocks, but what if I put a ball in the middle? Will it work? Can I hold it up that way? They're trying to figure things out. Now, after 2, it goes into the pre-operational, and it's a little bit different understanding. The earlier ages are about that simple understanding how things work. And then the older ones are like taking a broom and flying it around the room and planes and, experimenting. Now, school age is concrete operational. Why these words? They really don't make sense, the words, but, Piaget, this is what he liked because he's been studying children forever. Concrete operational is many different things, but what he says about it is if you have 2 glasses of milks, one's tall and one's short and fat, and you poured one into the other and they're the same amount of liquids, a younger child will pick the tall glass because it looks like more. But a school age child understands that's called conservation. All right, that word, why conservation? That's what they tend to use for this stage. And the school age child knows, doesn't matter, pick whichever one you want. I know that they're both the same. Now, formal operations is now again where they're trying to figure out things to get what they want, to conform again with the society. And they now are really understanding and applying what they've learned through their whole life. So this is a little bit more understanding about it and giving you your age groups. I'm not going to go into it again. Again, there's your primary, your circular, and the tertiary. It's like, what else can I do? Can it go together? And you look, they're doing all different types of rock blocks. And yeah, they do work. They don't have to be the same shapes. These are things children are learning. Again, going down through all of the different stages. We put some more in here for you. You need to look at them closely, but I've explained them for you already. Now, play. Play is so important. What do children do and adults do 24/7, right? We just want to play. We just want to have some fun. Now, children as they grow, go through different stages of play. Well, first of all, there's onlooker. I'm just going to watch, see what you're doing. And they just look. Solitary, they're playing alone with their own toys. Now, parallel play is 2 or more children, specifically toddlers are parallel play because it's me, mine, mine. They don't want to share, right? So they're playing together, same room, same toys, but they're not playing together. It's like I'm here and she's there and we're not, exchanging toys or working together at all. Now, associative play is now they're working together, but they're just playing together, sharing together. It gets to cooperative play where 2 or more are now have a goal when they're done, whether it's to build a castle in the sand or build a house with blocks or a board game, who wins the game. So it goes from looking to playing with someone with a goal. Now, cultural differences or religious differences, are something that we really need to understand. I came from a town where there was very little people from anywhere but the United States there. And I really didn't understand a lot of culture. And I moved down here when I was 21. So I had to learn. I learned Spanish really well. I married a Cuban. So my children are Cuban. Now my husband's Jamaican. So I've really gone multicultural here. But what you need to understand is how that culture will affect your child. How to know, is it food differences? We know some are vegetarians, some don't eat meat, I mean, or beef or all different things. The one thing you need to do is to ask. If you don't know, I have found out crazy things have happened in my career, I've seen things and I don't understand. I've always asked a parent, so excuse me if you don't mind, can you tell me what does that mean? And when they tell me, they were like, wow, she really was interested and understood. So very important to ask, okay? Now, another thing is spiritual, religious. What your beliefs, their beliefs. You don't have to say, oh yeah, I understand. I know what you're talking about. I don't know all the religions. I don't know what they're all encompassing. You only need to know your own spiritual perspective and allow them to do what they need to do, whether it's praying 6 times a day, right? Uh, Making your what you need to do for that child around what their needs are too. And spirituality is very important. So looking at a kid, how do we look at them? Well, always, always, always get down on their level or below. If you don't get on their level, you're looking down at them. And now you are extremely scary. You're very scary. Get on their level. I would have them on a bed or a stretcher, and I'd pull up a chair and I'd actually be below them. And they really like that. Another thing, one of the hardest things to do is to listen to breath sounds and heart sounds on an infant. If they're asleep in mommy's arms, please, I would go and listen to that first, because now I can really hear the kid's not cooing, moving, wiggling, because that's what they do, right? So a happy kid asleep, that's what I'm going to do, and I'm going to look at them. Now, one of the things that we don't like talking about is abuse in children, and you'll hear more as we go along through this course. But remember, if we have a kid come in with a broken whatever, and the kid and the parent stories aren't matching, remember, it's suspicious. I've seen abuse. I've seen horrific abuse. And then I've seen that one that could have passed by, but it was because something wasn't right, because remember, our job is to protect the children. The child is your most important thing. And remember, if this kid, let's say it's an older kid, or even cognitively delayed, because those are the ones that are really abused, what if they were a victim of sexual assault, abuse, or something? And the parents bring them in to get checked up. Don't forget the parent. Can you imagine how much suffering she's going through or he's going through to even bring them into the ER? It's scary. And remember, parents need their feelings addressed and known that, yes, you understand that they're going through a hard time. Charting physical findings. Well, you have histories and you have physicals. Physical is whatever you can see, hear, and touch, right? And that's all what you would chart for physical. Growth. Well, what's the most important thing for growth at any age? I mean, the pictures here. Nutrition, nutrition, nutrition. If nutrition isn't right, the kids' gas tank isn't full and they're not going to run the way that they should. Literally, that is it. Now, how would we know nutrition isn't given the way it should? Well, what do we do every single time they go to a doctor, an urgent care, or an ER? We do a
Does the
height.
patient's weight?
Yes, a height and a weight. And if it's not where it should be or too much, we know that's going on. Another thing, look at their developmental level. If they're 5 months old and they're not rolling from their belly to their back, something's wrong. They're delayed. Or if they're not able to sit unsupported by 8 months old and they're 11 months old already and they can't sit, something's wrong. And that's usually because of nutrition. That's the first thing that we look at. And then, of course, early intervention will be put in there. Another thing, if children, are not weighing what they should, one of the things that we could do to try to figure it out is have a parents do 24-hour diaries. We do these on any age children, right? When you're worried about diet, obesity, or any of those things. So make sure that you get that 24-hour, and it can really help you understand, well, they fed the kid water. Why water? It just filled up their belly. There's no nutrition. That's why the kid's skinny. Could be. Remember, it's double their weight at 6 months and triple it at 1 year. Now, there's always little variance, a little more, a little less is okay. And as long as they're developmentally, growth, they're doing what they're supposed to do, we look at those things differently. Now, looking at nutrition, we look at something called body mass index. Body mass index is their height and their weight. And actually, that's what they like to do, for giving medications, looking at it. But, in the BSA, but it has to do it's the height and weight where it should be. Now, if you're at the 85 percentile, you're at a risk. You're not overweight yet. You're at a risk. At the 95 percentile, now you are overweight. And that's just giving numbers of a BMI. Again, getting food diaries, finding out what's going on, we can help correct those things. Now, I just sort of mentioned those developmental assessments and why they're important. Because if we can figure out delays early, we can start giving early interventions. And the reason why I love children so much is that they catch up really quick. Kids who can't speak, within like 2 months are like, you can't shut them up anymore, right? Or the kid who couldn't walk, well, now they're running, you can't catch them. And it's awesome to see that most kids do catch up that way. There's all sorts of early intervention programs out there, and they're there to help infants and toddlers get where they need to be. Now, assessing an abdomen. Well, whenever you assess anything, number one, just look. I can see, is it distended? Is it, concave? Is there's lumps? Is there's bumps? What's going on, right? Very easy. I could see hernias, like umbilical hernias sticking out. That's an easy one to look at. But you do the left upper, lower, right upper, lower, auscultate, seeing bowel sounds. Percussion, see if there's anything in there. You can feel fluids. You can see their organs in there. And then, of course, the palpation does that too. Now, when you get on to capstone, you're going to have to do cardiac assessments, and you're going to need to know where all of these things are. So we review them in pediatrics also. So just know where you would put your stethoscope to get one of these assessments on a cardiac valve. So if you didn't know what the picture said, this is what they are, exactly where they are. So you can go be looking. If you've been told that your child has an aortic stenosis, you want to go to that second intercostal space on the right side, and maybe you can hear, that a little murmur, something going on, right? And I, as a nurse, I love to do stuff like that. Now, breath sounds. Children are really harder to listen to breath sounds because they have all this upper airway mucus. And a lot of times you think it's bronchi in the lungs, but it's actually all upper airway. So when you want to do, listen to the bronchial, which is all the bronchus and all the tubes, and then you'll hear that junk moving. It is over the trachea, and it's right between those clavicle, and it's called the suprasternal notch. And you really see that sometimes depressing and going inward in respiratory distress. So that's an important place. And then the bronchiovascular is up the trachea and the bronchioles. And then the vesicular is the lungs. This is where you're going to hear your breath sounds, the rales, the rhonchi. The other ones, you're going to hear a lot more upper airway. New nurses in peds, I'll tell them, take the stethoscope, put it on their neck, right on their throat. Same thing as putting it here, and you can hear it's all upper airway. Now, car seats. Car seats, there's has been changed through the years. Actually, I remember that little metal car box there with my brother little. And yeah, we used to sit in the front seat. In fact, it used to be my dad, and then it was me and my brother and my mother all in the front seat. So we've really changed over time. So remember when you're in a car seat that we do have it in the rear facing under the age of 2. And then make sure that they do have those good harness straps on. And remember, they can turn around at age 2. Their muscles, their necks are strong enough to be able to handle being forward. I had a hard time with this with my grandson because they say, was it 32 pounds in some literature? Well, this little kid only weighed 26 pounds at 2. Always been a little peanut. But the doctor said it's the muscles and, the strength of the muscles. It's not necessarily the weight. So at age 2, they can go front facing again in the back seat. They need to be in the back seat to age 13. And remember, car seats, they must be checked for expiration. Just don't go to a yard sale and pick one up. That could be very dangerous, okay? Make sure you know that. Now, infants. So we're looking at growth development. Remember, growth of development measures nutrition. It measures, a child's cognition, right? Are they alert oriented? Are there things that we need to get them into speech or occupation or physical therapy to catch them up? Now, head lag is when you take their arms and pick them up and their head bobs back. Now, that should be the first thing they have control of about 2 to 3 months, okay? Remember, at sleep, it's always back to sleep. It has prevented SIDS death, and there's been major research done on that. And we've decreased SIDS death by exponentially. It really has gone down. I know the hospital that I work closely at still is doing the research study on it, and for the last 20 years. As I said, at 5 months, they can go from their abdomens and roll over to their back. At 6 months, they go back to their abdomen, if you were wondering. When they're on their back and all of a sudden they're starting to explore the world, sensory motor, right? Feet come in the mouth, right? And they start sucking on their toes. They should be able to, at birth, have a reflex, a palmar grasp, and then it goes to an voluntary, and I want that rattle, and that's about 3 months. Again, they explore the world through their mouth. Teeth should generally come in at 6 months, should be the earliest age that they come in, and it's 1 tooth per month up to the age of 1 year. Now, teeth, if they don't get them at 6 months, does this mean they're behind? Absolutely not. Again, my grandson never had teeth at 12 months old. They got 6 at 15 months. They never walked at 1 year. They ran at 15 months. So as long as they're doing everything else right, they're okay. Now, when do they start pulling themselves up? Well, they start getting up on top of the couch and they can walk around, and that should be at 9 months. And as I said earlier, sitting unsupported, no pillows, by 8 months. Now, colic. I think this is one of the dreaded things of parents. Colic can last. It's a kid is crying. He's not wet. He's not hungry. He's not sick. He's just got all of this gas in his tummy. And usually, keeps parents awake at night. And it's a hard thing to deal with. You can position them, feed them right, give them meds, do everything, and they still have it. But it does usually go away by 3 to 4 months. And it doesn't matter, breast, bottle, nothing. Now, one of the things about colic, sometimes nurses say, oh, this young kid, the mom's calling me on the phone, crying all the time. It must be colic. Don't ever assume. It can be other extremely dangerous conditions. So if a kid is crying, mom calls and says, my infant has been crying at 2, 3 months old. Crying like 8, 10 hours a day, and I don't know what to do. Have them be seen by someone. Don't assume that it's just colic. Now, let's talk about children, and let's talk about stages of how do they develop. Well, sequential is simply a predictable sequence of growth. We know they lift their head. We know they go from their abdomen to their back to abdomen, up on their knees. Then they sit, and then they're going to stand, and they're going to creep, and they're going to walk by 1 year. That in a sequence. Doesn't mean they don't skip some of those, but as long as they're moving forward. Developmental pace is, remember, all kids are different. They do it when they're ready, but you know that they're going to have to walk before, they're going to have to like hang on and creep before they walk. They're going to walk before they run. And that's exactly what it is. And the sensitive period is periods where there is, where they can do things, where they're starting to learn language and movement all together, and it's sort of more of a quiet time. Nail fontanelles. You also know these are soft spots, right? Well, the anterior is going to be open to almost a year, to a year and a half. Usually about 15 months. This one will close. And then the posterior one, it's usually 6 to 8 weeks. Knowing when they close can help, because if it closes too quick, how's that brain going to grow? All right. Or what if you see bulging coming there? These are things that need to be explored. Now, babies are born and they have 2 eyes. This eye works independently from this one. So they're trying to focus, but they can't. So these kids look like they're cross-eyed because they're trying to figure out and focus in what they want. And then there's no depth perception. By 4 months, they should be working more together. But by 12 months, now they're starting to be able to see, they have depth perception. They're not as dizzy as they were as babies. Now, pain. Now, one of the things about pain in children used to be my pet peeve in nursing. They didn't think that infants had pain, or they don't remember, and they didn't really medicate them like they should. And then we realized, these kids do have pain, and they do actually have a little bit of recall even from infancy. There's, again, research on it. Now, what do you see when you see an infant in pain? Well, of course, they'll be crying, but you're going to see them, the eyes closed, the forehead. You might see the little chin quivering. You're going to see the legs moving, and you might hear them whimpering. Definitely, this is pain. Remember the pain scale, FLAC. Faces, legs, activity, crying, consolability. These kids you can't console, okay? And this is up to age 3, and at 3 it becomes faces. And this is also nonverbal children. Now, sits deaf, as I said, back to sleep. The only time that they're up and on their belly is when they're wide awake, and that will help with the shaping of their head, or they're going to have that flat head in the back, right? So actually, tummy time is encouraged because of the head. Now, nothing in the crib but the child. No toys, no blankets, don't overdress them. No smoking in the house around these children. If they've recently had a little viral infection, like little nose, upper respiratory, you're more apt. Younger mothers and formula fed, breastfed have least a decrease in the incidence, and males are more than females. Reflexes. We talk about the grasp already, okay? The other one I would say here would be the moro, or the other name is startle. You make a noise and the kid's just gonna come up. Or if you bump the crib, their legs and their hands are gonna come up. And that's just testing the central nervous system, seeing if it works. I mean, that Babinski is just like adults. Rooting is when they want to feed. You put a little brush their cheek and they're going to look for the breast, and they're going to look for the bottle. Especially in the younger children, I've used that to get them to eat. And then the other reflex that is there, it starts about 6 to 9 months, and it's called a parachute. Take an infant, turn them on their belly, and put them down quickly into the crib, and you're going to see their arms and legs come out. And it basically is there to protect themselves. They'll always have this. That's why children always put their hands out when they fall, right? That's why broken wrists are the biggest bones that are broke. parachute reflex is always there. Now, nutrition. Nutrition. What are we going to feed them? Well, the first 6 months is only milk, whether it is breast milk or iron fortified infant formula. We know that it should be for the first year of life. Those are the only milks that these children get. If they are having 6 to 8 wet diapers, we know that they're getting enough. And of course, we're weighing them. They're coming in at 2 months, 4 months, 6 months, and they're getting all these immunizations, right? We're weighing them. We know that they're getting enough nutrition if their weight's getting better, right? So that's the way to look at. And of course, vitamin D should be given to breastfed babies. It helps with the growth. Now, at 6 months, the GI system was very immature before that. It means if you ate something, you would see the particles in their stool. By 6 months, they're starting to tolerate it a lot better. And what we start to do is we start introducing foods one at a time, waiting 3 to 4 days before adding another one. And it could be simply a rash, or it could be vomiting, diarrhea, abdominal pain, or it could be a total rash on the body. And that they say is just stop it and don't reintroduce it. If it's a small rash, the physician might say, do it again. But usually you're not going to feed that till later on in life. And at 1 year old, you need to switch from breast milk or formula and switch it to whole milk. And they need the fat. The fat, again, is healthy for their central nervous system. Your first immunization that we give is hepatitis B. Hepatitis B is usually given at the hospital before they go home. Now, one of the things about immunizations in children, and it's the one thing about needle phobia. In fact, my doctoral dissertation was on school-age children's attitude and behavior towards injections. Well, what I saw was there's needle phobia, and parents have it, and they're afraid their baby's gonna hurt because they have that fear. So using a topical anesthetic will reduce that pain and also will make the mother feel better. So the mother's going to be more apt to make sure she's on time for these immunizations. And there's your whole big schedule. And you have one in the book too. Toddlers. I love toddlers. These are the me, mine, I want. Again, when you approach these children, you're going to get down to their level, okay? And you're going to start examining them by maybe asking them, where's their ears, where's their nose, or, talking to them first, and then get their confidence, and then they will start warming up to you. Because if you try to go in and immediately, let's say you need a blood pressure, and you go in and you don't play with them first, you don't get on their level, that kid's going to scream and yell, and it's going to take you forever to get a blood pressure that probably is not accurate. You take the time, you play a little bit, takes a couple minutes, and now you have that toddler pushing the button on the blood pressure machine. It works a lot easier. Pain again. We know toddlers are in pain. Their ages 1 to 3. Again, they're flack. Flack is going to be the newborns, the infants, and your toddlers. One of the things we can do, we can give all the medicines in the world, but children doing distraction techniques, whether it's playing with them, whether it's turning on music, whether it's repositioning, massaging, all of these things, what you've done is you've taken attention away from their pain. So these non-pharmacological strategies for pain will reduce perception because they're not thinking about it, right? So it could just be repositioning, Hopex, Colpex, but distraction works great. I mean, older kids, give them an iPad, give them a game to play, and they're going to forget most of it. Again, remember, when giving pain medicine, if you have an IV, give it IV, or please use a topical anesthetic to help them. Now, toddlers, again, they're growing slowly. It's they'll gain a little bit of weight and then they'll get a little taller. It's very slow. Their nutrition is horrible now. It's their what we call physiologic anorexia. They're picky eaters because they're starting to taste a lot more now. So they're getting more picky. I think it's the age of chicken nuggets and macaroni and cheese for most toddlers. Now, toddlers are getting now, at the end of infancy, they're barely walking. So now you have ages 1, 2, and 3. Their coordination's going to get better. They're going to be using both hands. They're going to be throwing a ball. It may be down to the floor, but they're going to be doing that by about 18 months. Their social development they have one word. Well, now they're using one and multi-word sentences by ages 2 or 3. And because this is the age of potty training, right? They're going to be starting to try to dress themselves. Oh, by the end of age 2, they should feed themselves. And they should maybe undress themselves, get ready for the shower or for the bath, right? Now, toilet training. Toilet training, yes, you've got to have these signs of readiness, but believe it or not, it's the bowel that you do control before the bladder. That is the first, because they can feel when they have to move their bowels. It's a lot bigger feeling than it is to urinate, okay? So that's where that should start. Now, injury protection, terrible twos, right? Dive bomb kids, intense exploration, looking under, over, around, and figuring out stuff, and they're into everything all the time. Now, these kids do things, you tell them no, and they do it again, and they do need some discipline. Timeouts are the best. 1 minute per year old. Timeouts are the best form of discipline. Let them know what they did wrong, have them be quiet before the timer starts, and let them sit there for a 2-year-old 2 minutes. Now, preschooler, we're still slow in growth. Nutrition, again, they are still picky eaters, but they do eat, and they're going to usually just eat what they want. Now, Kohlberg, we talked a little Kohlberg. Well, Kohlberg is morality, right? This is right and wrong and a consequence for each. Well, when you talk about children and getting to preschoolers, they don't want to have things taken away. Like maybe they don't want their toy, or maybe they do have an iPad that they're using. They don't want it taken away, or their cartoon on TV. They don't want it taken away, so that motivates them to do right. Okay. And now they're also starting to understand other people's emotions. Like if mom's not feeling there well, she's laying on the couch. This is a child who might just get a cover and put it on them. Yes, kids that are preschoolers can do that because now they're starting to understand other people. Now, I can't tell you how many Band-Aids I have in this house and how many different types. It's from Paw Patrol to Batman to Superman to clear ones, the brown ones, the big ones, the little ones, because my grandson is 6, just turned 6 in January. And it's that age right before is the age of Band-Aids. Band-Aids make it all better. The other thing is they feel that if blood's coming out, if they don't put something and cover it, all their blood's going to leak out and they're going to die. Very common. Preschoolers, as I said, in pain, we're not flack anymore. At age 3, we turn to faces, okay? So they can look at those pictures and they do it really well. Gross motor skills. These children at this time should be able to jump a rope, they should be able to bicycle, they should be able to hopscotch, walk a line, skip. They're doing a lot more and more and more as they get older. Standing on their tippy toes. I think when Christian started hopping on one foot, he thought that was really cool. Gross motor skills of the, again, what I just said. It's the end of the preschoolers. It's bicycle, rope, hopscotch. And the one thing about kids, they want to do what the other kids do. So if they can't, they're going to be frustrated. Fine motor skills. Oh, now they're being able to button their shirts, color inside, being able to take Legos and put them together, even small pieces. And they really like doing that. Preschooler is that age where we're getting ready for kindergarten. Now, kindergarten might be the first time that they have to sit and have an attention span, and they have to learn. Now, it doesn't all just start when they get to school. Parents need to promote a positive attitude towards learning. They need to be reading books to them nightly if they can. Let them be out with other children, whether it's sports or other activities, so they learn how to work with other children. And this age, children, you need to start speaking to them, not like babies, like they're more grown up, so they're hearing all the words. Communicable diseases. Of course, upper respiratory is like crazy. They're always with boogers in their nose, right? Young kids. Of course, pink eye, diarrhea, fifth disease, which is, you'll see like these little scabs on them, which is the hand. Fifth disease is slap face. Hand, foot, and mouth is where you get those little scabs on your hand or your mouth, et cetera, et cetera. Now, one of the things here says chicken pox, and you're going to say, well, they get that varicella vaccine, right? Well, you still can get chicken pox with the vaccine. So one of the things that I worked in an emergency room, I had to be careful about was any child with a low-grade fever who had these rashes that were like juicy on the tips and all different stages of healing, I would protect myself, put a mask on me, and get a mask on the kid and get them into a negative pressure room where the air does not come into the rest of the environment. Cheyenne, I'm sorry, I just saw your hand up. Did you need something?
Yeah, I was just gonna ask a question. So with the hand, foot, and mouth, it's not very common for adults to get it, right? But they can.
Right.
Is it common for adults to get it worse than kids?
It depends
Like
on
if
your
they do
immune
get it?
system. Depends on
Okay.
the immune system. You know, remember, as we get older, we build up all of these immunities. Hand, foot, and mouth, it rages through the kids when it comes out. You know, because
Okay.
they're sharing all of their everythings, their pencils, their pens, their books, their toys, and it goes around. And it
Hmm.
looks nasty on them too.
Well, it was just
Usually,
interesting because my three nephews got hand, foot, and mouth, and then my sister got it too, and she got it
wow.
worse than the three little boys combined.
Well, so
Yeah.
probably she had never been exposed to it.
Okay.
Probably that's what it was.
Okay.
All right, thank you.
Thank you.
You're welcome. Again, we talked a little bit about abuse earlier in this, but remember, with abuse, it's always to make sure the child is safe, okay? Remember, there's physical, there's neglect, and there's sexual abuse and emotional. Neglect is, not getting food, shelter, clothing, even bathing, medical care. And then that sexual, emotional, and always remember, if you have a child who's being brought in, remember the parent. Those parents are bringing them in because, let's say their child, mentioned something that somebody touched them and did something, and they're getting them checked out. Don't forget that parent. It's a hard thing to do. Again, nutrition, they require preschoolers about 1,200 to 1,400 calories a day. And we need this much of stuff, and you need to know these things. 12 to 1,400 calories, protein, 13 to 19 grams, because protein is what? It's good for wound healing, and kids are always falling and, breaking their skin, et cetera, right? They always have a boo-boo somewhere with a Band-Aid on it, of course. And we know calcium for those strong bones and teeth. So, one of the things with nutrition is, remember, cultural, and remember nutrition can be a problem if a child is, like, let's say, with iron deficient anemia. That child, you'd need to teach those parents to add more green leafy vegetables, eggs, and meat in their diet, and that will make up for what they need for, because they are, those vegetarians, right? And then iron deficient. Now, school age, ages 6 to 12, starts with the baby teeth coming out. It ends with puberty and the final teeth in. It is a long period of time, so they grow a lot. But it is 6 years, so it is a gradual. Again, this is conservation. Remember, school age is conservation. Knows that, coins of different shapes, there's still 6 coins, and each one is still 6 coins. And school age children understand that. Again, remember, they're pleasers. And the one thing we need to remember is that even though a child looks older or more mature, don't assume it, because I've got this 9-year-old grandson who looks older, but he's only 9. And you have to remember to speak to him like the 9-year-old. Injury prevention. All injury, when you see questions, are usually motor vehicle. Across the board, motor vehicle. Whether they're in them or ran over by them, and then adolescents driving them, okay? Rear seat till 13 years old and a booster seat till 8. Always use all of the equipment that you should have, okay? And one of the things with injuries in children, so you have a kid who's at home going through something, whether a divorce, whether a death of someone, or a moving, or something that, upsets them. Remember, these kids might do some risk-taking stuff, and you might see a risk factor for injuries is when that home is stressful due to all of those things, okay? So if a kid never was having injuries and they're starting, something to look at, what's going on at home. ATVs should not be used by children younger than 16. Where I live, they're going down the street all the time younger than that, and it really does scare me. And trampolines are really a thing that causes injuries. And I look in my backyard, and I think there's 3 of them going down the street, so it's a lot of them. School, not in my backyard, school age children and obesity. Now, today, why are children obese? Well, they are obese because, and it's to the point of almost an epidemic now, because what do children do? They come home from school, drop their bags, and they go right to their games, their iPads, their Switches, their whatever TV, and they sit. And they don't get up and go out and play outside and burn off calories. So, one of the things about school age children is, if we don't correct this as a school age children, there is an increased risk of cardiometabolic changes. They can have diabetes and hypertension as adults because of it. Now, obesity does not mean one group of people are going to be obese. There's no racial or cultural barriers here, okay? But school age children are a great group to teach, because they do learn, they do listen. Remember, school age is all about same-sex peers, okay? Now, preparing for procedures. Remember, what are the age of the children? They're 6 to 12 school age. So a 6-year-old, you're going to say, okay, we're going to go do an x-ray of your arm. And he's going to look at you and think gamma rays are going to come out and zap him, and he's going to be irradiated and killed, right? No, a big camera is going to come and go over you, and it's going to click, click, and make sounds. And then you're going to have a picture of your insides. And what I always do is I'll pull those pictures up for those children to see. When they see the crack in the bone, they understand it a lot better. Or see the consolidation in a lung with pneumonia. It really does help. These kids are smart. Big common thing that happens in school age is ADHD. And remember, attention deficit, the major thing is distractibility, inattentive, hyperactivity, impulsivity. They start tasks and they don't finish any of them. Now, one of the things with this school nurses is these children get so disruptive, they send them to the school nurse. If a parent needs to come in for counseling to find out what they're doing, don't assume they're doing nothing and the kid's just rotten and getting away with whatever. Some of these parents have gone to here, there, and everywhere to make sure their children have what they need to take care of this. So listen as a school nurse to them, and then together you make your plan. Now, depression. You're going to say depression in kids? Oh, yes, absolutely. I mean, and even usually it's your older school age and of course your adolescence. Now, remember, adolescence all about body image, right? If they don't like their body image, it leads on to a feeling of lack of self-worth or that negative self-image, right? So they don't feel good anymore. And what do you see? Well, they gain weight, they lose weight. They sleep a lot, they don't sleep a lot. They don't go out with their friends. All of these things can be depression. And remember, if a kid ever says something like, nobody really cares about me, I wish I was dead, take it seriously and get that kid help because they will and they have committed suicide. Dental health, brushing, very important. Flossing is very important, but remember, younger kids, like first graders and younger, they don't know how to floss yet. So it's hard. I mean, those little sticks are better, but flossing is the older kids. Soft bristles, fluorinated toothpaste. And when you start seeing teeth coming out too early, it's poor dental health. And if they have cavities, it's going to hurt. They're going to tell someone. Mhm. So, adolescence, I've mentioned it a couple times. This is identity. Who am I? And they're going to try to do what they want, when they want, how they want, because they just want it, right? So, what do we need to do? We need to set limits and structures, and we need to be there to support them, okay? They're going to be constantly, you tell them to come in at midnight, they're going to come in at 12:30 just because they're going to keep testing, testing, testing. Again, body image, that negative self image can cause that depression. And the leading cause of death in children that are adolescents is suicide and homicide. And homicide is that motor vehicle again, or doing risk-taking behaviors just because, all right, I'm old enough now, let me check out daddy's gun, right? And that's when things can happen. Adolescents, nutrition. You think adolescents know better. Well, think about adolescents and they're into all these social events, school, trying to get everything done, and they're too busy to eat. So they eat on the go, a bottle of water and a power bar, and they run, right? So if there's issues with eating again, what do? Of course, 24-hour diary of the foods. There are all sorts of eating disorders. So checking their weights like we always do, figuring out what's going on can, if we catch it early, is better. Adolescents, about age 12, it's that HPV vaccines. It's actually a 3 series that should be done on it. So HPV to prevent cervical cancer. And then talking to adolescents about sex. Now, most adolescents, it's that age of, as Freud says, is about checking out their sexuality, right? So with adolescents, again, you need to break open the ice with them. You can't just come out and start talking because they're going to look at you because you're an adult. They ain't going to listen. So get on their level, ask them what's going on, ask them what they want to, if they've picked a college out yet, or do they play sports, or what's their favorite subject, or what music do they like? I mean, there's so many things you can go with. And remember, these children will talk if you do it in the right way. One of the ways is telling the parents to leave the room and sitting there and listen, really listen to them. So again, it's gaining that trust, listening, and then they can discuss with you. And you don't have to tell the parents what they said unless it's going to hurt them or others, okay? You know, as I said with food, well, they're not sleeping either. They're always on the phone, they're studying for exams, or they're out at school sports events till whatever time, and they're not getting the sleep that they should. And remember, the beginning of adolescence is that pre-adolescent growth spurt, right? They're growing 25% of their height and weight at that point. So they do need sleep, they do need nutrition. And if they don't get it, they're going to be these children who fall asleep, you know, during the day. So again, they need to sleep a long time, even more than 9 hours a night, but they don't get it. And it's not because they don't want it, it's just because of they're so busy. You know, I've talked about depression, suicide already. Know that suicide can happen for many different reasons. Again, if you hear a child say something, take it seriously. Tanner, stages of development, always on your NCLEX, always on your HESI. Always know it starts with 1 and it goes to mature at age 5. Female starts with breast buds, and when you talk males, it starts with enlargement of the scrotum, okay? And as they go into puberty, remember that menstruation usually starts after you start seeing the changes. So you start seeing, like in girls, their breast buds starting, you know, you have about 2 years until they go into menstruation. Not uncommon at all for girls to have irregular menstrual cycles, have fast increase in height and weight. Remember, this is that prepubescent growth spurt. So all of this hormones are going on, you know, their height, their weight is getting taller and bigger, and all that hormone, they are moody, moody, moody. Fowler's faith constrict again. Remember, with spirituality, like I said in the very beginning of this, know first who you are before you can even try to understand someone else. I mean, not all of us have spirituality, and some have their own beliefs. That's okay. You have whatever keeps you doing the right thing, okay? But always know yours first. So there are 5 basic dosage calculation problems. I did send out all of the handouts on dosage calc. There are some really good examples on that. If you haven't looked at it, open it, see it, and practice it. And if you do need help, let me know. I'm always here to help you with a dosage calc. Any questions? I did it in 1 hour, pretty good.
Thank you.
Oh, you're always welcome.
Thank you.
Anybody needs anything?